Our biggest accomplishments in 2025 were that we were able to offer more diagnostic tests at all of our 3 clinic sites across Ventura County at Westminster Free Clinic and Community Care Center. And that included free Cologuard colorectal cancer screening tests in partnership with Cologuard. That included free ultrasounds at our clinics and free EKGs. So that was a really big thing because it helps people not have to go pay somewhere else and have that test at the same time they're coming to see their doctor. So that was one. Another was we had over 100 high school students in our teen internship and training program graduate and go to college and get accepted to college, from Harvard all the way to community colleges. And most of our students are first generation low-income students, so that's very exciting to see them have the opportunity to be accepted into college. And another was that we saw more patients this year. That's a good and a bad thing because that means there's more need. But we had a 21% increase in the number of patients that we served across our 3 clinics. And we also provided food to 15% more people this year. So over 600 families a week, or 110,000 individuals. And that was thanks in partnership to Food Share. And we also provided diapers and used clothing when we give out the food as well every week. So those were some of our accomplishments, but probably our biggest one is that we were named one of the nonprofits of the year for the state of California. So that's the one we're most proud of, and means a lot to us, and we were really surprised when we were selected and really grateful. Probably the first that probably every nonprofit will say is funding. Fundraising's become much more difficult because before we weren't competing with hospitals and universities and other entities who got federal funding. And now they're applying to the same places that we're applying for funding. And it's tough as a nonprofit to compete when there's a whole fundraising department or a whole financial department at a university or hospital compared to a nonprofit. But they're having to do that because they're losing funding and they're trying to survive too. So that's our biggest challenge, is coming up with funding sources that will select a nonprofit. Another challenge we have is supporting the low-income population that we serve in a time with so many changing environments, and making sure that being adaptable and addressing those needs, changing environments like fires and floods and politics and the economy are all really impacting the population that we serve, even greater than the general population because they're low income. And so making sure we're always adapting and changing to those needs is a challenge. We're able to meet, but it's a challenge. And then another is, one of our missions is to help high school students, over 350 a year, have a pathway out of poverty and to go into careers in healthcare. And we're a workforce healthcare training site to do that. And the big challenge right now is having our low-income students, who are over half of the students that we are serving in that training program, feel they can afford college and feel that college is still for them. And so keeping their spirits up and helping them find ways to fund it. And then on the other side, making sure we do get them through college, because there's a huge gap in healthcare workers as record numbers of doctors and nurses and other practitioners are retiring right now. And so many people are having to wait a year to get an appointment. And so by helping fill that gap in Ventura County, we need to keep these kids on a track to go into careers in healthcare. So that's another challenge that we're working on. So those are the main challenges that we face. So funding, meeting the changing needs, supporting the community with changing environments and needs, and then helping our youth still feel that college is for them. Well, we have many hopes and goals for 2026. I think the biggest one is we hope to open a 4th clinic. We have 3 clinics right now. We have one on the East County in Thousand Oaks. We have one in Oxnard Plain in Oxnard, and we serve the Santa Clara Valley through our Santa Paula Clinic. And we provide this healthcare training program for youth from those communities, and then we also meet the immediate needs and healthcare needs of the populations in each of those areas. We would like to do that exact model in another site. So opening up a fourth site with new funding would be our biggest goal for 2026. Another goal we have is to recruit more doctors and healthcare practitioners, because all of the medical services we offer, which I mentioned, over 19,000 services this year, people served, we want to have more practitioners because we've seen a 21% increase in the number of people we served in 25, and we anticipate that's going to go up in 26 because of all the people losing their insurance due to changing policies. And so we want to be sure we can meet that need. So one of the needs we have is more volunteer doctors and healthcare practitioners, because all those services we provide are free. So that's another goal. Another goal we have is to make sure we can find funding for our youth to be able to afford college, so that they can continue to reach their goals and dreams and have a pathway out of poverty. So that would be our other goal that we have this year.